Good evening and thank you for joining us. Ottawa is sending military aid to Saskatchewan to help that province fight its fourth wave of the pandemic. It's a worrisome situation. The cases of COVID-19 are climbing and ICUs are so stretched, patients are being transferred to Ontario. Saskatchewan is now considering entering a new phase of triage, formally outlining who gets potentially life-saving care and who doesn't. Recent modeling suggests that to bend the curve, the government needs to impose new and more restrictions. And as Abigail Bimman reports, that's not happening.
Yeah, big country fans. Big country fans.
Shopping for new gear ahead of musician Eric Church's Saskatoon Stop, the first big show in Saskatchewan since the pandemic began.
I think we're all just really excited to get out of the house and all of us younger people all got our vaccines so we could do this. Yeah. So.
You need proof of vaccination or a negative COVID test to get in.
There's going to be like 14,000 people there. It's a little scary.
The concert is a stark juxtaposition for doctors like Alex Wong, who have been advocating for temporary public health measures like indoor gathering limits as the province's COVID rates climb to become one of the worst in this country. With 77 people filling ICUs, patients continue to be transferred to Ontario this weekend, up to 3 a day expected to move early next week. And of the 288 people with COVID-19 in Saskatchewan hospitals, 72% are not fully vaccinated.
The way out of the pandemic is still vaccinations, and we all had hoped that we would have higher vaccination rates to reduce this.
Ottawa is promising help. The Prime Minister tweeting, "Saskatchewanians, we've got your back." The military is getting ready to send up to 6 critical care nurses, plus help with patient transfers and potentially backfill more nurses. Talks are underway to send further help, including from the Canadian Red Cross.
We appreciate that something is coming in now to help support those doctors and nurses that definitely we see how much they are overwhelmed.
The province is also considering something they haven't had to do before, stage 2 of triage, formalizing the process of choosing who gets care and who doesn't when there aren't enough beds.
It's obviously horrible. I'm not sure that there's going to be any realistic way that we're going to be able to avoid that because we just have too many people coming in.
The Canadian Armed Forces expects to be on the ground in Saskatchewan until November 17th, but say they are prepared to stay longer if necessary. Meanwhile, next door in Alberta, 9 military nurses remain. That help is expected to wrap up next weekend. Abigail Bimman, Global News, Ottawa.